we know that there's some elements in the crowds at these debates which are just uncomfortable, man. There's a meanness, a cruelty, something distinctly un-American, a savageness about it, which is really loathsome. I think to a lesser extent it resurfaced last night, but it did. Wolf Blitzer, talking to Ron Paul, he asks a question of Ron Paul, asking Ron Paul, look, you don't favor the Obama health care plan. What would you do? He sets up this hypothetical, Wolf does. 30-year-old guy, good job, good money, doesn't want to pay $200 to $300 a month for health care. By the way, he wouldn't have to pay that much. But $200 to $300 a month, he says, for health, doesn't want to pay it. And he poses the question to Ron Paul. Here's clip one.
Who's going to pay for if he goes into a coma, for example? Who pays for that?
In a society that you accept welfareism and socialism, he expects the government to take care of it.
What do you want?
But what he should do is whatever he wants to do and assume responsibility for himself. My advice to him would have a major medical policy, but not before.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
I didn't realize that the core of freedom was taking your own risks. That freedom in this country meant bungee jumping without a rope. That's what this country is really all about. No, it's not about taking risks. That's not really why we fought the British, so that we would be able to go forward in life and not have health care. Because guess what? We're not going to let that guy die. You know why? Because we're America, because we kick down the door, because we're great. We don't let him die. Now, coming up, Blitzer follows that up and tries to get narrow with Ron Paul, like, hey, what does that really mean? Here's clip 2.
But Congressman, are you saying the society should just let him die?
No, I practice medicine.
So there you go. You heard it a little bit there. The woo, should we just let him die? Now, unlike at the debate in California, at least it wasn't thunderous applause from the whole audience. Yes! Yeah! America #1, we kill. No, it was clearly some people were uncomfortable and some people didn't applaud at all. But there was this notion of, should we just let the guy die? And yeah, here's the deal. We should just let him die. That was the reaction there. So then, but that's not even the part about this that alarmed me the most. It was then Ron Paul's explanation, and this is what these guys are about. They don't like government, and this is what it's about. So here's clip 3 with what Ron Paul says would happen. He wouldn't die because other people would step in. Here's clip 3.
I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of them. We never turned anybody away from the hospital, and we've given up on this whole concept that we might take care of ourselves, assume responsibility for ourselves, our neighbors, our friends, our churches would do it.
That's what's happening right now. That's what the whole problem is that, yeah, he doesn't have health care, so he's going to go into a hospital and they're going to take care of him. And someone's going to have to foot that bill because he can't afford it. Ron Paul literally makes the argument of why we needed health care reform. But he said, no, just the churches, the hospitals, the Catholic hospitals, they'll take everyone. That's the issue. So then the ultimate point for libertarians and for these guys who loathe government, Ron Paul finishes it up.
We have lack of competition. There's no competition in medicine. Everybody's protected by licensing. We should actually legalize alternative health care, allow people to practice what they want.
Yeah, licensing. That's the problem here. We need to stop licensing people. If you want to practice alternative health care, just do it. Say, I'm a doctor. So guess what? I'm a doctor. Do you have a health care issue? Come to me. I will undercut everybody's costs. Out there, look at can we take that shot out there? JR, Steve, Jesus, doctors, all 3 of them. We have a practice together. Whatever your problem is, we'll fix it between $50 and $1,000. That's our top cost. That's all it's going to be. And if our doctoring business doesn't work out, we're all lawyers. We don't need the American Bar Association. I'm a lawyer. I'll give you legal advice. I have a computer. I got Wikipedia. You don't need to go to a lawyer. Ron Paul, we license stuff that matters. You have to have training and you have to be licensed. It's not just let's just see if the business works and make sure it's okay. You can't just make drugs. You can't be a pilot. You can't be a lawyer. You can't be a doctor just because you think it's okay and we should be able to practice whatever the hell we want. That's the world you're going to live in, with this nonsensical sense that Washington doesn't help, that Washington doesn't contribute. That's what you're getting with these guys.